Assalamu alaikum, everyone. I would like to welcome each and every one of you for our very first annual recognition ceremony via web conference with the theme of Nursing Education Amidst Pandemic. My name is Sister Carmela, and I'm one of the clinical instructor of Hail General Hospital, and I will be the moderator for today's event. First of all, I would like to acknowledge the presence of our honorable guest speakers, the CNE designees and CRNs, and all nursing personnel that are joining us today in recognizing the CNE designees and CRNs of Hail General Hospital for their remarkable contribution and dedication in continuing nursing education in spite of current health crisis. Knowing the importance of continuing education, it allows nurses to ensure integrity of nursing delivery system, drive for excellence, and focus in increasing nursing quality care. So to give us the introductory remarks, let us hear from Ms. Amal Al-Rashidi, clinical instructor of Hail General Hospital.
Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Dear colleague, welcome and thank you for joining us in Hail General Hospital Continuing Nursing Education Annual Ceremony for 2020. Today, we are celebrating the effort of our CNE designee and clinical resource nurses in continuing nursing education activity compliance. Continuing nursing education, it's not a work for one or two staff nurses. It's a work for a team who have a good communication skill, collaboration, eagerness to learn. Each one participate in achieving the main goal to standardize nursing practice and unify the common goal to provide safe, high-quality nursing service. Dear continuing nursing education designee and clinical resource nurses, thank you for keeping up with all education activity. You are doing a great job. Let us continue our work and be a good role model for all the staff nurses. Thank you.
Thank you very much, Ms. Amal, for that wonderful remarks. So to give us the overview of activities conducted in Hail General Hospital in the year 2020, I would like to call on Ms. Kristine Angeles, the Head of Nursing Education of Hail General Hospital.
Assalamu alaikum. Thank you, Sister Carmela. I would like to welcome and thank everyone, my dear colleagues and our respectable guests, for joining us in the tradition of recognizing the efforts of our CNE designees and CRNs. I am Kristine Angeles, the Head of Nursing Education, and I am here today to disclose HGH CNE in 2020. The year 2020 has been an unprecedented year and has come a challenge to healthcare world in terms of pandemic response. Continuing education and training is one of the integral part of the nursing professional advancement. Harnessing the knowledge, skills, and attitude of clinical nurses become more challenging due to the restrictions caused by the pandemic. Indeed, due to COVID-19 pandemic, large group and face-to-face educational engagements have been greatly affected, mostly canceled in compliance with the MOH guidelines to prevent possible transmission. In spite of these challenges, we are proud to present some of the learning activities that we have conducted in achieving the prime objective of constant education to keep up and elevate the clinical functions. From January to November of this year, 2020, the nursing department has received a total of 54 new and transferred staff nurses. To realize the concept of socialization, the CNE has provided these staff with proper orientation, departmental and unit, and ensured that all of their personal files and credentials have been verified. In addition, the team of CRNs, or clinical resource nurses, ensures that all staff deployed in their area are competent through continuous competency assessments. We are not here to only orient nursing staff, but also to socialize student interns from bachelor's and master's program to the nursing profession. CNE firmly believe that these future nurses have or must have the essential knowledge and skills in our hospital by first orienting them of the guidelines the nursing department has laid onto them with the agreement from their respective universities. In the beginning of the year, when there was still no restriction, the CNE designees conducted ward lectures and case presentation in their respective clinical areas. This event is to recognize all the efforts of the CNE designees and CRNs who, in their own abilities and through their hectic schedule with nursing care delivery, have embodied immense effort to continuously educate nursing staff in their respective clinical areas through one-on-one teaching. Clinical resource nurses, or what we call CRNs, unendingly, despite of their own patient assignment, doing competency assessments for all staff, may they be senior or junior and cross trainees. They make sure that implementation of the program and the competence of the nursing workforce are updated and recorded. At this point, we have reached 100% compliance and completion with the mandatory competencies, 97.7% of general competencies, 92.3 generic competencies, 92.3 unit-specific 1 competencies, and 92.3 unit-specific 2 competencies. For annual unit-specific competencies, we have reached 93.7. As you know, we have received new staff, and some of them are on vacation. Some of our old staff are on vacation. That's why at this point, we are not yet in the 100% completion. But I am proud to say that all of our staff nurses who have completed the competencies have graded, passed. Thank you, clinical resource nurses, for doing the competency assessment for your staff. Without you, this number or this percentage will be very low and most probably will not be able to meet the competency standards of our nursing service department. The nursing department was also challenged during the transition of healthcare system of HGH from paper-based to electronic medical record, or EMR. As we move to the digital space, we were able to have a remarkable transition with the help of hardworking CNE and CRNs in teaching staff. In coordination, of course, with the nursing quality management and follow up by the nursing supervisors and head nurses. With the pandemic restriction, CNE have not stopped their effort to reach out, educate, and train nursing staff through the advent of digital methodology. Little by little, we will be able to surpass this challenge, and we will continue to explore other methods to teach staff. As the representative of the nursing department, I would like to take this opportunity to commend our nurse leaders who were involved in the nursing researches entitled The Mediating Effect of Work Motivation Between Psychosocial Environment and Nurses' Job Performance in the Hospitals of Ha'il Region, Kingdom of Saudi Arabia, and evidence-based practice and barriers to its implementation among nurse practitioners. It is also my honor to present and congratulate everyone who contributed their time, knowledge, and effort for the research on safety attitudes of nurses and their demographics, a basis for continuous quality improvement, which was published on the European Modern Studies Journal. Thank you to our advisors and mentors from NSO and the University of Hail. Without your help, we won't be able to come this far. At present, we are currently on the data collection of the nursing research entitled The Perceived Benefits and Barriers of Continuing Education Among Staff Nurses in Hail General Hospital, Kingdom of Saudi Arabia. The CNE conducted an assessment on November 5 to 22 of this year, 2020, which aimed to identify the learning and training needs as perceived by the nurses of Hail General Hospital. CNE have acquired 235 responses out of 329 nursing workforce within the scope of study. This table shows us the ranking of all clinical topics the nurse identified as extremely important to their education and training. Ranked first is safe drug administration. This slide shows us the professional development concepts that are deemed extremely important by nurses. The results of this learning needs assessment were tallied, carefully analyzed, and integrated in the 2021 academic and training program for nursing staff of Hail General Hospital. To sustain the nursing mission and values and maintain quality services, CNE aims to provide nurses, midwives, and nursing assistants with up-to-date knowledge and skills through continuous, integrated, and interactive educational activities and training programs in accordance with the NSD Policy 017-5, the Nursing Education and Training Program. In compliance with the policy, the plan includes 22 in-service training programs and 8 general courses, 2 of which are in coordination with the Academic Affairs and Training Department of Nursing Administration, Hail Health Cluster. To ensure a more organized and swift working dynamics and monitoring of nurses of Hail General Hospital, the CNE will still apply the clustering of clinical areas and will be supervised by the clinical instructors. Please be guided that the rotation of the cluster CIs are as follows. Cluster 1 includes female surgical ward, ER, ICU, endoscopy, and one-day surgery under the guidance of Mrs. Carmela Baay. Cluster 2, which includes female medical, OB ward, pediatric ward, pediatric ICU, and outpatient department will be under the guidance of Ms. Amal Rashidi. Cluster 3, which includes male medical ward, isolation ward, male surgical ward, NICU, and delivery room will be under the guidance of Ms. Jenifer Malarvizhi in 2021 academic program. I have come to end my presentation and the brief summary of what happened with HGH CNE in 2020. We hope that we will be able to continue and do more improvements to achieve higher goals in the coming year 2021. All the best to all of you, dear colleagues. My sincerest gratitude for working with us, and congratulations and enjoy the rest of the program. Once again, I am Kristine Angeles, the head of Nursing Education, High General Hospital. Thank you for listening.
Thank you, Ms. Christine, for that great and valuable presentation. So we have seen that in order to secure that nurses are still competent in terms of their knowledge and skills, in spite of the pandemic, the nursing educators of Hail General Hospital are really considering other means of activities or educational activities, okay, just like how we had conducted before. So moving forward with our program, I would like to invite our clinical instructor, Ms. Jenifer Malarvizhi, to introduce our next speaker.
Assalamu alaikum. Thank you, Sister Carmela. I'm extremely glad to introduce the keynote speaker for today's event. She has completed her Master of Nursing Administration and Education from King Saud University, Riyadh, with first honors in the year 2019 to 2020. She has also completed her Bachelor of Nursing Science, Faculty of Nursing from Hail University with first honors in the year 1436. She has also completed her General Nursing Diploma from Health Institute for Girls in the year 1426. She has started her career as a staff nurse in King Khalid Hospital, Hail region in the year 2004 to 2006. In a very short period of time, she has been promoted as Deputy Head Nurse in Pediatric Intensive Care Unit in King Khalid Hospital from the year 2008 to 2009. She has been a member of Patients' Rights Committee, who is responsible for policies and procedures for Well Baby Clinic and Patients' Rights in Al-Muntaza Al-Sharqi Health Center, Hail region from the year 2009 to 2015. She is teaching and training supervisor in the nursing administration in the region in the year 1440. She is a member of the board of directors at the Council of Saudi Nurses Association in the year 2019 until now. She is also ambassador of health education from the Saudi Society of Family and Community Medicine in the year 2018. She is also a member of Saudi Management Association from 2016 to 2017. She is also a member of Saudi Arabian Society of Culture and Arts from the year 2016 to 2017. I'm extremely happy to welcome our keynote speaker, Ms. Wadida Darwish Al-Shammari, the head of Academic Affairs and Training in Nursing Administration. I welcome you, ma'am. The floor is now open to you for the keynote address.
Hello, assalamu alaikum wa rahmatullah. Thank you, Jenifer. Good afternoon to all of you. We are happy really and actually proud of the outcome from Hail General CNE department, as the continuing education and the training is one of the integral part of nursing professional advancement, and indeed, due to the COVID-19 pandemic, large group and face-to-face educational engagement have been greatly affected, and the CNE designee with the CRN in your hospital, really they did an amazing work with the pandemic restriction. The CNE have not stopped their effort to reach out, educate, and train nursing staff through the advent of digital methodology, as I saw the result by Sister Kristine. So little by little, we will be able to surpass this challenge, and we will be continuing to explore other methods to teach the staff. So thank you for all of you.
Thank you very much for that very inspiring keynote, Ms. Wadida. We really appreciate your presence in this event, and we hope to have you again in our future web conference activities. Thank you very much. Moving on, let's all hear the messages coming from the head. I'm sorry for that. Let's move on for the messages. First, coming from the Director of Nursing Administration, Hail Health Cluster, Dr. Nashi Mesned Al-Rashidi.
Thank you, Sister Carmela. I will just play the video first that has been sent by Dr. Nashi. And I know that he is with us right now, so we will give him the floor if he has any other message after the video. Thank you.
Good afternoon, everybody. Dr. Nashi Rashidi, Director of Nursing Administration, High Cluster. It's my great pleasure to welcome all of you today in CNA ceremony. First of all, I would like to thank the CNA designee for doing one-in-one lecture. And second of that, we would like to thank the CRN for making sure that nursing are competent. Thirdly, I would like to thank the Nursing Services Department and CNA for implementing this education program. Finally, I wish that training and education will be more improved and continuing in the future. Thank you.
Thank you so much, Dr. Nashi, for that message. I know you are here with us. Would you like to say some words additional to what you have sent, Doctor?
Good afternoon for everyone. I already say my message through this one. And really, I'm very proud about the CNA and High General as always. Always they are doing more what we expected from them. Thank you, and so much we are proud of you. Thank you again.
Thank you so much, Dr. Nashi and Ms. Wadida, for joining us today. We really appreciate your time that you have spent with our activity. Thank you so much. At this point, I would like to share the video message from our hospital director, Dr. Talal, AlZabni. I'm sorry, just wait for a while. I'm having some technical problems. Just wait for a while.
Good morning, everybody. I'm Dr. Talal, AlZabni, Hospital Director. I would like, first of all, to welcome you joining this Zoom activity. I would like as well to thank the Nursing Services Department for this effort and this activity. My thank as well extended to the CNA Department for their efforts. And I hope all the continuous education still continue and get improved as well to ensure that all staff competency. Thank you.
Okay. On behalf of Nursing Service Department, I would like to thank all Hail Health Cluster Nursing Administration for your valuable and insightful messages for the nurses of Hail General Hospital. We humbly appreciate your participation in this event. Let us now proceed to the awarding of certificates. Clinical instructors will be presenting the certificates to their respective cluster designees. We will start with cluster 1. Ms. Amal, can you please now present the certificates to your designees? Thank you.
Thank you, Sister Carmela. Awarding the certificate for recognition, certificate of appreciation for his effort as CNE designee in the clinical area for the year 2020, given in this day, 10 of December 2020, signed by the clinical instructor, head of nursing education, and director of nursing. Emergency department, CNE designee, أنجو أبراهام، أريم مول، خلف عايد، ساريتا ناير، ريجل غارسيا as reliever. Female surgical ward, بشاير سليمان، روهيندا عليان، شيما وادي. Intensive care unit, شرجانا أبينغ، راديكا موركان. One day procedure, مرزوقة فواز، وداد الحميدي as reliever. Step down ICU, أنو تشاكو، جوسنا جوس، تينتو توماس. Clinical certificate of appreciation for the her effort as a clinical resource nurses in the clinical area for the year 2020, given this day, 10 of December 2020, signed by the clinical instructor, head of nursing education, and director of nursing. Emergency department, Amira Mansour, Femina Jos, Somi Thomas. Female surgical ward, Mizi Diab. Intensive care unit, Kristine Anne, Shanet Sani, Silsha Kumari as reliever. One day procedure, Al Hanouf Tami. Step down ICU, Jetho Jos, Milan Mari, Nisha Jos, and Ria Ali.
Thank you, Ms. Amal, and congratulations to all Cluster 1 CNE designees and CRNs, and of course to your cluster instructors for her cluster instructor for her efforts in guiding all of you. We would like also to acknowledge the new designees in the Cluster 1. Okay, so now I would like to give the floor to Ms. Jenifer to present the certificates of recognition to her cluster designees.
Thank you, Sister Carmela. Certificate of appreciation to the CNE designees for their effort in the clinical area for the year 2020, given this day on 10th of December 2020 via Zoom conferencing, signed by 3 clinical instructors, head of nursing education and director of nursing. The CNE designees of female medical ward are Aurora Antonino and Minumol PK. For OB-GYN department, Amal Munif Male Al-Rashidi and Sama Mohammad Al-Bakri. For outpatient department, Vedad Awad Dehem Al-Anisi. For pediatric intensive care unit, Maria Teresa Tudosio and Daisy Davis as reliever. For pediatric ward, Swapna Joseph and Reena Sam as reliever. Let's move on to the clinical resource nurses awarding. Certificate of Appreciation for the clinical resource nurses for their effort in clinical area for the year 2020, given this day on 10th of December 2020 via Zoom conferencing, signed by the 3 clinical instructors, Head of Nursing Education and Director of Nursing. Female medical ward, the clinical resource nurses are Laibi Thomas, Nurnihar Hussain, Limi Lucas as reliever. OB/GYN ward, Aisha Amesh Fahad Al-Anizi, Divya KV. For outpatient department, Aisha Dehem Awad Al-Rashidi and Fauzia Aid Awad Al-Rashidi. For pediatric intensive care unit, Mariam Abdullah Hamoud Al-Rashidi and Mona Dahi Salem Al-Harbi. For pediatric ward, Janalin Sayurin and Tahani Mubarak Frey Al-Shammari. For nursing office, Betty Susan George. Once again, congratulations dear CNE designees and CRNs of Cluster 2 departments for your hard work. Thank you.
Thank you, Ms. Jenifer, for joining us today, even you are on vacation. And congratulations to all Cluster 2 CNE designees and CRNs, and to your cluster instructor. Last but not the least, allow me to present the certificates to my cluster designees, CNE designees of Cluster 3, Certificate of Appreciation for his and her effort as CNE designee in clinical area for the year 2020, given this 10th day of December 2020 via Zoom conferencing, signed by all the clinical instructors together with the Head of Nursing Education and Director of Nursing. For delivery room, Amal Dahar and Suad Saadi. For the male medical ward, Ornella Panim and Taj Mahal Khalid as a reliever also for CRN. Male surgical ward, Jenifer Supnad and Janice Joseph as reliever. For neonatal intensive care unit, we have Gina Joy and Catherine Misa. For isolation ward, we have Sheila Jan as CNE and CRN designee. For the Cluster 3 clinical resource nurses, Certificate of Appreciation for her effort as clinical resource nurse in clinical area for the year 2020, given this 10th day of December 2020 via Zoom conferencing, signed by clinical instructors and Head of Nursing Education and Director of Nursing. For delivery room, Amal Obeidallah Al-Rashidi and Apriana Dirman Sitompol. Male medical ward CRNs, Ahmad Tulayhan Al-Shammari and Lorraine Ann Benico, together with Monica Chris. For male surgical ward, we have Rosemary Jan and Ans Mary as reliever. For neonatal ICU, Cherry May Abarilla, Hanilet Rojo, Riham Obeid Al-Shammari, and Shireen Sebastian as reliever. Once again, congratulations to all the designees. And I am very proud that I had an opportunity to work with all of you. In regards to the outstanding designees for the year 2020, clinical instructors had come up with the special awards. The awardees' performance are carefully evaluated based on the objective criteria that the clinical instructors have formulated. Finally, for the special awards, I would like to call on now Ms. Kristine to present the special awards.
Thank you, Ms. Carmela. Thank you to our clinical instructor for presenting the awards of appreciation to all our CNE designees and clinical resource nurses. You really deserve that. Okay, at this point, we are to give the awarding of special awards. Certificate of recognition to CNE designee of the clinical area for having complied with all CNE activities, that is lectures and updating online spreadsheet for the year 2020, signed by all the clinical instructors, myself, and Director of Nursing, Mr. Ahmad and Shammari. Outstanding CNE designees from emergency room, Andrew Abraham, Ariamol M. From male medical ward, we have Miss Ornella Panim and Taj Mahal Hali. Male surgical ward, we have Jenifer Subnat. From neonatal ICU, we have Gina Joy and Miss Catherine Nisa. From outpatient department, we have Miss Widad Awad. Congratulations. Now, certificate of recognition to clinical resource nurse for having implemented 100% compliance and passing rate of nursing competency program in their clinical area for the year 2020. Efficient CRNs are from female surgical ward, Macy Diab. From intensive care unit, we have Miss Kristine Ann Benico, Sasha Kumari, and Shanit Sani. From one-day procedure, we have Miss Alhanouf Tan. From female medical ward, we have Miss Laibi Thomas, Miss Nurunihar Hussein. From pediatric ICU, we have Miss Mariam Abdullah and Miss Mona Dahi. From pedia ward, we have Miss Jeneline Sayurin and Tahani Mubarak. From delivery room, Miss Amal Obeidallah and Miss Apriana Dirman. From neonatal ICU, we have Miss Cherry Mea Abarilla, Hanilet Rojo, and Riham Obeid Al-Shamri. And from isolation ward, we have Miss Sheila John, who is also a recipient of CNE award, special award. We also have from male medical ward, Miss Lorraine Benico and Miss Monica Chris. We have from male surgical ward, Miss Rosemary John. And from nursing office, Betty Susan George. For the one-on-one teaching, we would like designees, but also for clinical resource nurses who really extended their own time for providing lecture for their focused staff nurses. So with highest performance, we got 3 outstanding awardees for this particular award. So congratulations to Miss Ornella Panin, top 3 highest performance in providing one-on-one teaching to nursing staff. Congratulations. Top 2 goes to Miss Hanilet Rojo for providing one-on-one teaching to nursing staff. And last but not the least, we have Miss Maria Teresa Chodosho, top 1 highest performance in providing one-on-one teaching to nursing staff, given this 10th day of December 2020, signed by all the clinical instructors, Miss Amal Musad Al-Rashidi, Jenifer Malarvizhi, Carmela Baay, Head of Nursing Education, and Director of Nursing, Mr. Ahmad Al-Shami. Congratulations. The clinical instructors, Sister Amal Musad, Sister Jenifer Malarvizhi, and Sister Carmela Baay, for their patience and hard work. Without you, I will be nothing, and we will not achieve anything. So with that, please accept our simple appreciation to all your efforts from the Nursing Service Department. Thank you very much, Ms. Amal Musad Al-Rashidi, Cluster 1 Clinical Instructor.
Oh my God.
For Cluster 2 Clinical Instructor, Ms. Jenifer Malarvizhi. And Cluster 3 Clinical Instructor, Ms. Carmela Baay. Thank you so much for all your effort. Thank you so much.
Thank you very much, Sister Kristine. We are not expecting this.
Yeah.
And to
Thank you so
everyone,
much.
in your own little way, CNE designees, CRNs, thank you so much for teaching our staff. We really need you in this time and every time. So the nursing service department, really thank you so much.
I'm speechless now. Thank you so much to our Head of Nursing Education. So I would just like to acknowledge also another name from my designee, Diyos na Diyos of Isolation, as a reliever also. Thank you so much. Okay, so moving on. The Nursing Service Department had made an effort to express our honor to our CNE designees and CRN of Hail. Let's all watch a short visual presentation prepared by our nurse leaders.
السلام عليكم ورحمة الله وبركاته. معكم أسماء عازمي نائبة قسم النساء والولادة. I would like to thank you for CNA and CRN for teaching OB/GYN staff, and I want to thank you for CNA and CRN for teaching even during pandemic. Thank you very much.
Assalamu alaikum. I am Rima Obeid, head nurse of Bidya Ward. I want to thank for all CNA and CRN, Jalal, Tahani Mubarak, Swabna, Rina Sam. I want to thank you for everything, for helping to staff and good teaching. And also I want to thank you, the CRN and CNE, for teaching even during pandemic. Thank you.
Assalamu alaikum. معكم نوف رجا, head nurse of Biko. I will say big thank you for my CRN and CNA, Maria Teresa and Daisy, Mona and Mariam. حابة أشكركم بنات على الجهد اللي أنتم قاعدين تعطونه والمجهود اللي تبذلونه حتى مع الشغل وضغط الشغل الموجود هنا في البيكو. I want to thank you to CNA and CRN for teaching even during pandemic. Thank you.
Assalamu alaikum, I'm Khalaf ER head nurse. I would like to thank our CNA and CRN for give our staff education and continuous learning in our ER department.
Hi everyone, I am Jisha George, head of isolation department. Thank you for our CNA and CRN members, Sister Sheila and Sister Josna, for teaching and helping us during the pandemic situation. Keep up the good work. Thank you.
Assalamu alaikum, I'm Shammari, the head nurse of NICO. I want to say thank you for our CNE staff, Sister Gina and Sister Catherine, and our CRN, Sister Hanilet, Sister Cherry and Sister Riham. They are always helping us and teaching all the staff, even during pandemic. Thank you for the effort.
السلام عليكم، أنا رعد الشرطان، رئيس تمريض قسم الباطن الرجال. حاب أشكر قسم التعليم المستمر ومكتب التمريض السيني والسيارن لتعليمنا خاصة خلال جائحة كورونا. الله يعطيكم العافية وما قصرتم.
Assalamu alaikum. I am Arij, nursing supervisor. On behalf of all supervisors, I want to congratulate all CNA, CRN, designee for your achievement and for teaching all nursing even there is COVID-19. We are so proud of you. Good luck and continue your hard work. Keep safe all.
Hi everyone. My name is Mahanadi, the head of Nursing Quality Management. On behalf of Nursing Quality Department, I would like to thank all the CNA and CRN designees for your good effort for teaching the staff even in pandemic situation. Thank you for hard work. All the best. Thank you.
Assalamu alaikum. I am Thamir, Deputy of Nursing Director. I want to congratulate all our CNA and CRN designees for their great work for the continue nursing education even it's pandemic. We really appreciate all your effort and we are so proud of you, all our designee for the teaching, all the staff nurse. Continue be a role model, provide that one the quality nursing care. Thank you so much.
Okay, in addition to that video, some of the head nurses of other departments were not able to provide their messages to their designees, but they also want to express their acknowledgement to their respective designees. So once again, your great contributions in continuing education is highly appreciated. Eventually, before we formally end this recognition, let us all hear from the Director of Nursing, Mr. Ahmad Tuaysan Al-Shammari, for his appreciation message to the CNE designees and CRNs. Please bear with us. Sister Kristine will present the video that he has presented.
Hello, we will just pause for some time. At this point, I would like to thank everyone who is here with us today in the activity. Ms. Wadida Al-Shamri, Dr. Nashi, Rashidi, Dr. Talal, AlZabni for giving their message, and also our Dr. Jalal Nayem Al-Harbi, the Chief Executive Officer for Nursing Planning and Improvement of Higher Health Cluster. Thank you very much for always supporting us. We'll just
Okay, for the meantime, I would just like to give a reminders, okay? So for all the designees, for your certificates, okay, it will be available here in nursing office. So you can come to nursing office and claim your certificates. Thank you.
okay. Just an overview of what we are going to do in 2021. Okay, I'm just actually buying time because we are also still waiting for one guest to join us. And just an overview, our plan of activities for 2021 has already been done. Thanks to all of you who joined and submitted or conducted the learning needs assessment. Okay, for this 2021 plan, okay, we will start now the training of all our CNE designees to give okay, the in-service training. Okay, before we have trained you in doing ward lectures based on evidence or literature, right? So at this point of time, starting January, inshallah, we'll be able to train you more, okay, in giving in-service training here in nursing office for your staff nurses or for specialties, okay, and we will also be with the advent of the EMR, electronic medical record, inshallah, we'll be able to focus on clinical documentation, how it is important not only for the nurses, but also for the provision of patient safety and ensuring patient safety for our customers. We really hope that everyone will be able to extend more of your effort. I know that you are having some hard times because you are also having or assigned to your patient, but really your efforts, okay, and your reporting makes a very big difference, okay, to our organization. Without your reporting, without your effort, we will not have any data that will support our actions. That's why we always encourage everyone, okay, to document everything. Assalamu alaikum. At this point, I would like to thank Dr. Jalal, Nayem Al-Harbi. Okay. Assalamu alaikum, Dr. Jalal. Thank you very much for joining us today. And I really apologize, I sincerely apologize for the late notice that I have sent. I'm really sorry, Doctor. For all the participants, let us welcome the Chief Executive Officer for Nursing Planning and Improvement, Dr. Jalal Nayem Al-Harbi. Welcome, sir.
Thanks, Christina. Assalamu alaikum, all of you. And no worries, Christina, for late announcement for me. I was really waiting the link and I was also on meeting, just escaping from the meeting because of the session. I really highly appreciated all the audience, and I use another name because I faced some technical issue in my computer, and I use my friend's computer to just join your meeting. I really apologize for late but I missed a lot of things in the beginning. Just I'd like to share. Are you hearing me?
Yes, Doctor, you are very loud and clear, and thank you so much.
No worries, cool. Sorry again, and really apologize for late and I missed a lot of things, but I am sure it's a valuable meeting and a lot of valuable also comments and suggestions from all the CNE supervisors. And as you know, if we view nursing as a branch of medicine that is evidence-based, it's follow that theory and practice for all the nursing branch. And nursing will change over time. Unfortunately, now, just I noticed, unfortunately, nurses generally do not keep a practice with this change. And unless there is regular training and updating of the skills from the CNA. So we are really, will be honest with you, we will face risk feeling behind in best practice care prevention if we don't activate the CNA in the proper way. So I know really big responsibility for you, and I am sure you will do it very well in all the CNA supervisors with the nurses. So as you also know, ongoing training is therefore important component in maintaining the competency of nurses. Not only does regular training expose nurses to evidence-based shift and approach to their practice, but also provide guidance to identify poor practice that may have crept into their day-to-day nursing practice. So also, as you may know, it's very important for all the CNA to ensure that the educational programs that are being introduced both to the day, up to date and relevant to the target nurses being introduced. Does it make sense to you? we have to keep us in the day update and relevant to the target of nurses. So we have to see what is the nurses need in our field. So I am really trusting all your work. I'm trusting all your program you will provide it to the nurses. And I know it's really big responsibility for all the CNE supervisors. And I will use this moment to really greet our CNE, head CNE, Ms. Wadida, also Dr. Nashi, Ms. Nayem. They are really keeping in track with the CNE to follow up all the CNE supervisors. Just it's required from you, please, to work as a team to improve our nurses' outcome. All of you here?
Yes, Doctor.
Yes, Doctor.
Yeah. Is Mr. Ahmad here?
Yes, Mr. Ahmad is here, Doctor.
Oh, cool. So I also really appreciated Mr. Ahmad for his organization this meeting. And hopefully it will be really helpful for all of us. And they will be really supportive of all the activity you will provide to the nurses. And highly appreciated all the CNE supervisors. It will be really big challenge in front of us. But with the teamwork, I'm sure we will pass this challenge. So it's required from all of you, please, if you don't mind, to cooperate to each other, to work as one team. I am looking for all of you to improve our nurses' outcome and also the culture of nurses here. I'd like to see something big difference from the previous and now. And I'm looking also to meet with all of you face to face, and we have to work on our planning, and we have to implement our planning, inshallah, in the near future, inshallah. I will ask from Ms. Wadida also to organize a meeting face to face, inshallah, and we'll see we'll put the highlight, what is the important stuff to work with or to start with. So I really highly appreciated all your attendance to this meeting. So is any questions for me, or is any? I'm really happy to answer it.
Thank you so much, Dr. Jalal. Actually, Mr. Ahmad is here with me, and he is also thankful for your presence for this activity. For the presence of Ms. Wadida, Dr. Nashi, and Dr. Jalal, it's really overwhelming from all of us here in Hayal General Hospital that you really trust the nursing service department, now with the leadership of Mr. Ahmad. Trust us that we will do everything that we can to educate our staff and maintain and achieve quality patient care in coordination with all the nurses in the hospital. Again, thank you so much for joining us today, Dr. Jalal.
I don't have any doubt about that, Christina. I know you are, all of you, hardworking CNE supervisors, and I know you have a lot of knowledge, all of you, and I am sure you will improve our nurses to provide a good care for our patients also. It's very important to combine also quality of nursing with the patient safety, with patient care. It's very important to deliver our knowledge, our practice to our nurses. So thanks again for your invitations, and I'm looking to meet you again and again.
Inshallah, Doctor. Thank you so much.
And again, I apologize for late coming and with the technical issue. So I am happy to be with you and until end.
Inshallah. Thank you, Doctor.
No worries. Is Ahmad here?
Yes.
هلا دكتور موجود.
حياك الله أحمد، كيف
هلا. الله يعافيك.
يعطيك العافية أحمد على الاجتماعات الطيبة هذه، وإن شاء الله إحنا واثقين بالعمل اللي تعملونه كمستشفى حي العام بتطوير مهنة التمريض إن شاء الله، بما يخدم المنطقة ويخدم مرضانا بحول الله وقوته.
شاكر ومقدر وجودك دكتور، ولا نستغني عن دعمكم وتوجيهاتكم بإذن الله.
بدون التعليم المستمر، بدون عمل الدورات والورك شوب والمحاضرات للزملاء والزميلات في مهنة التمريض، ما راح يكون في ابديتنج يعني لجوده العمل. فاتمنى انها تستمر ان شاء الله المحاضرات والدورات التدريبيه والورك شوب بما يخدم ان شاء الله المرضى ويخدم البيشنت سيفتي برضه. وامبروف اور كواليتي نيرسينج ان شاء الله.
ان شاء الله باذن الله.
ان شاء الله كملوا وانا مستمع ان شاء الله حيكون جيد ان شاء الله.
Thank you so much, Doctor. At this point, I will play the concluding message of our none other than Director of Nursing, Mr. Ahmad Al-Shammari.
ورحمة الله وبركاته. معكم أخوكم أحمد طيسان الشمري، مدير خدمات التمريض في مستشفى حي العام. فخور لأنه يشارك في هذا الفيديو، شاكر ومقدر لكم جهودكم. Once again, I want to acknowledge the hard works of our CNA, designee and CRN for teaching and guiding the nurses of High Gen. Even there is pandemic. Thank you for your dedication. Your efforts are truly appreciated, and we hope that you all will continue guiding and teaching the nurses in your clinic areas. Let us all work together in providing optimal nursing care and also to our patient or to everyone in this hospital. We are all proud of you.
Thank you very much, Mr. Ahmad, for that appreciation message. On behalf of Nursing Service Department, I would like to thank all the guest speakers who spoke with us today, the head nurses, nursing supervisors, quality improvement head and supervisors, the deputy of director of nursing, the director of nursing, and all our CNE designees and CRNs. Your cooperation in continuing education is vital to ensure quality nursing care in line with the current working world of health and nursing. We look forward in working to all of you to keep up and elevate clinical functioning. To my colleagues in CNE department, the clinical instructors, thank you for your cooperations. Thank you, Ms. Amal and Ms. Jenifer. And of course, to our head of nursing education, who is working extensively and always guiding us to become an effective nurse educator. Thank you so much, Ms. Kristine, and I am proud to be part of this team. Thank you, everyone, and please visit us in nursing office for your certificates and some giveaways. Thank you.
We will just leave the meeting for some time so that you'll be able to type your name in the chat box, your name and your unit, so we'll be able to register your name in the attendance sheet. Thank you so much.
Thanks, Christina. If you excuse me, I am leaving the session now. And inshallah, I am really looking forward to see all of you in the near future. Thanks again for this session.
Thank you so much, Doctor. Thank you.
Thank you, Doctor.
See you, bye. ألف شكر لك حبيبنا.